thank you to the TransplantChild for inviting me to present this webinar. I have nothing to disclose. Here are the topics that I will present today. We will start with the medical context of transplant and some bioethical questions. Then we will explore this experience of pediatric donors, and we will go further with the methodology and the results, and we finally go to the conclusions and the future recommendations. So if we take a look of the medical context, we can say that allogenic transplant is a life-saving treatment for many pediatric conditions, malignant and non-malignant diseases. The common indications are leukemia, bone marrow failures, immunodeficiencies, and inborn errors of the metabolism. An allogenic transplant requires a stem cell donor, and in many occasions, a sibling donor is the preferred donor if there is a match. There are, we have, for those who are not hematologists, but in the audience, we have two main stem cell procedures of donation. We have the bone marrow harvest that you have here in the upper picture. It is performed under general anesthesia and typically requires a short hospital stay. This is the bone marrow harvest, and this is the peripheral blood stem cell donations that requires the use of growth factors. And we collected these cells through apheresis. Both procedures are safe. Serious complications are really very, very rare. There is also cord blood units that we can use, but this is not an invasive procedure for the donor. In pediatrics, we prefer the bone marrow harvest above the stem cell harvest because of the characteristic of the bone marrow, and also we are not very keen to use growth factors in otherwise healthy children. But there are some bioethical considerations that we have to evaluate. The donor receives no direct medical benefit of the donation. The decision of the donation is made by parents and by physicians. The donor and the recipient are emotionally connected, what introduces a strong emotional dynamics within the family. Also, children may have a limited understanding about the procedure. So this can lead to emotional stress, feelings of responsibility, and also family expectations. Key ethical questions and ethical concerns are autonomy. Can a child meaningful assent to a procedure? The best interest of the donor. Is this procedure justified without any kind of medical benefits? The family dynamics. To what extent do pressure and expectations influence the child? And the short and long term of emotional effect of the donation in the donor. And now we will go to the study, but before I start, I want to share with you one clinical encounter that I have. And actually, this clinical encounter was the basis of the study. I make a consultation with a 6-year-old boy who was the donor for his brother. And when I was explaining the donation, I told him, okay, this is a bone marrow donation. You will sleep with us one night, and after that, you are going home, but you are going to school. And the child was really very happy. He said, oh, I am going to the school. Great, again. At that moment, I realized that this child understood was something different. So I spoke with him further, and actually, at the end of my consultation, he understood that in the operation room, what for a child of this age is really a very abstract thing, something will happen, and we will change one life from another. So in the operation room, we will change his life for the life of his brother. Of course, this struck me also. The parents were very much in shock about what this child thought, and we could explain him. But what struck me the most, besides what this child was understanding, is that he was okay to proceed with the donation. So this was the basis. I discussed this with our psychologist, and I told him we really need to learn what the children are really thinking about the donation. And this is the basis of the study. So we know that the donation is safe, but much less attention has been given to the crucial perspective of the donor. How do children themselves experience being a donor? What to really understand? What do really they feel? To explore these questions, we conducted a qualitative study focused on the lived experience of pediatric stem cell donors. We use, as mentioned, qualitative analysis and also the interpretative phenomenological analysis, or IPA. These are psychological analysis. Why qualitative research? Is because they focus on lived experience, explored meaning making, and is suitable for complex emotional experience. The IPA focus on how individuals make sense of experiences. It based on in-depth interviews of small samples, as our sample is, and have a double interpretation. The participant meaning making, but also the research interpretation. So we performed a retrospective study in our department from donations. They were from 2010 up to 2023, with minimum 1 year after the donations. The donor were all younger than 21 years, and one requirement is that they had sufficient Dutch language mastering because of the in-depth reflections. We contacted 19 siblings, 4 declined and 2 were unreachable. The reasons for declining was waiting to leave all behind, no time, or no interest. Of the 13 donors who were who wanted to perform the study, 4 were males and 9 were females. The mean age at donation was 11 years, and the mean age and interview was 19 years. So they were older, so they can really reflect on the donation. In 10 cases, there was a positive outcome of the transplant, but in 3 cases, the patient died after the transplant. So we come to the results, and first of all, I will let the donors speak, and these are quotes. So the first theme is family loyalty, and these are quotes of the donors. I think at that moment, there is little need for permission. It's something you find obvious at that moment, and you just do it. If you can help your brother or sister with it, then you just do it. It was immediately my choice, of course. I had no choice, but that was my choice. But yes, I don't know how to say that. You can't say no, right? It's my sister, so I am obliged to do it. To help her, so I just did it. Of course, I wanted to do it. He's my brother. If I can help him, why wouldn't I? So we see the very important aspect of family loyalty in children. Many donors express a strong sense of responsibility toward their siblings and experience donation as something natural and self-evident. Donation is framed as an act of love, with a strong family identification, but also helping is perceived as unquestionable. And the aspect of this research was the emotional pressure. I felt I had to do it. And these are quotes of the donors. I think I could do it voluntarily anyway, but maybe with a bit of pressure as well. Like I have to do it. It's important that I do it. I think I realized it was urgent because of my parents, as they emphasized that it was serious and really needed. I didn't actually realize the pressure I was under, because it was actually life or death, as you say, and I didn't realize that. I didn't really think about saying no because everyone was hoping it would work. So emotional pressure. Although donors wanted to help, some also experienced implicit pressure related to family expectations and responsibility. So there are implicit expectations. There are really feelings of responsibility for the survivals of the sibling. And there is a lot of difficulty to imagine refusal in this situation. Another aspect that can be found is the feeling of the feeling of the donors of feeling overlooked. Everything was about my sibling. Here are the quotes. Maybe a bit more appreciation and thank you. I was the background dancer. When family visits, more attention went to my sister, but that's more than normal. But at that moment, you do think, hello, I'm still here. I often didn't know what was going on during the process. And when I was in the hospital, I often sat alone waiting. I often felt invisible. I didn't feel like a family member any longer. Everyone was busy me with my sister. Nobody really asked how I felt about the donation. So some donors felt their emotional needs overlooked, as attention was primarily directed to the sick sibling. Emotional needs remain unspoken, and feelings of invisibility of being secondary are really at the foreground. This highlights the importance of actively listening to the donors. Then we have the relation between age and donation impact. We see that younger donors have less concrete understanding of the procedure, may rely on magical or simplified explanations, and they are mainly focused on helping their sibling. Older donors have a greater awareness of the medical risk, reflect on responsibility of in the outcome of the sibling, and have a more complex emotionally processing. But these feelings change over time. And here are quotes of the donors. The feelings can stay there. From the donation, everything that happened over those 4 years fell on me, and that wasn't really fun. You fall into a black hole. I don't mind that I have few memories of it, because not all of those are beautiful memories, so I am glad I've forgotten a lot of those bad memories. Another quote: when I was younger, I didn't think much about it, but now I realize how important it was. So the emotional meaning of donations evolves over time as children grow older and reinterpret their experience. The patterns that we observe are feelings of pride and altruism, the sense of responsibility about the outcome of the sibling, and retrospective reflections happen in adolescence of adulthood. This highlights the need for an ongoing psychological support and recognition of the donors. So now we are ending. We go to the conclusions and future recommendations. Clinical recommendations are to integrate a donor-focused psychological assessment, to provide a structured, age-appropriate preparation, and to ensure, and this is probably the most important aspect, to ensure a follow-up after the donation with the donor. Not only 1 week or 2 weeks, but also later, in order to give place to discuss the feelings. Research directions is, it would be very interesting to perform longitudinal studies about the long-term donor experience, to make an in-depth research exploring the age-related psychological outcomes. Also, to see what happened with those donors whose brother or sister died. After the transplant, we have just 3 donors in this situation, so it would be very interesting to see this more in depth with a more number of donors. And also to develop donor support interventions. Because no child should never fail a background dancer, pediatric stem cell donors must be recognized not only as participants in a medical procedure, but as children with their own lived experience, emotional worlds, and voices. Thank you.